My name is Paul McColgan, and I'm the director of the Lifting Neighbourhoods Together initiative. Lifting Neighbourhoods Together grew out of about 20 years of experience that we had in community renewal, working in small neighbourhoods of about 5,000 people, where what we began to realise is that in terms of the public system, the solutions to poverty had become more complex than the problem itself. If you think about how do we solve poverty, what are the kind of ingredients required to lift a neighbourhood out of poverty, then we've got things like fair work, helping people to get a job that pays a wage that they can support themselves and their family on. If they're not able to work, then making sure that they get all the benefits that they're entitled to. People want to live in a decent environment, an environment that's not covered in litter or with waste ground. People want to live in a nice place. And people want to have a sense of being able to contribute to some of the key decisions that affect the place that they live in. So there's an important part around people being empowered to participate in planning processes. People want to be healthy. They want to have the opportunities to have the best health and well-being that they can. Young people need to have opportunities when they leave school. They need to have the chance to go on to college or university or apprenticeships or work. And these are all the kind of ingredients that you need to lift a neighbourhood out of poverty. But if we look at how the system is organised in terms of those ingredients, what we see is a very, very complicated picture. And if you put yourself in the shoes of a person living in a neighbourhood like that, then there's a whole plethora of organisations trying to help, doing their best and trying to help. But which door do you go in? It's very, very difficult to know, if you're an individual, how to get the right sort of support. And of course, people who are living in circumstances like that, they need support from a range of different agencies. They're not just going to need support from one agency. And unfortunately, even in the best situations where some of these organisations are a bit more joined up, they tend to be joined up in a kind of linear way. And so it's almost like a conveyor belt, where an organisation will do a little bit of work for someone, then their remit runs out and they have to refer them on to another agency. And then they go to that agency, they do a bit of work and their remit runs out, and then they need to go to the next agency. And for an individual, very often that means that people have to tell their story again and again and again. And it can be quite demoralising. And also they have to build new relationships again and again and again with people in these different agencies. And one of the things that we've discovered in recent years is that a lot of the time when someone steps forward to ask for help, the first thing that happens is an assessment process. And the assessment's to find out whether or not that person's eligible for that service. Do they meet the rules? Do they fit with the rules? And sometimes, and sadly quite often, the answer is, sorry, you're not quite the right person for us, or we're not quite the right agency for you. But if you go down the road, there's another agency and they'll be able to help you. And that has a large negative impact on people's confidence. So we thought it's time to try something different. It's time to try and see if, instead of people having to fit in with organisations' narrow set of rules, can we change that around so that the organisations begin to try to see if they can fit around the needs of individuals and families living in an area, and to see whether or not we can do that in a way where people don't need to tell their story all over again, where people can go through one door and it will be the right door, and that they can have a lasting relationship with someone when they go through that door who will support them to identify what they want to do in the future and walk with them as they get support from different agencies in a very integrated and coordinated way. So lifting neighbourhoods together is a test of change. It's about trying to see, can we move from the current silo system where we have organisations with narrow boundaries, narrow sets of rules, to a situation where we have a local integrated team. And that local integrated team will take care of managing the relationships with an individual or a family, so that they have the trust that they build up when they come through the door. That's conveyed into the introduction to the type of support that they need. And the way that we envisage this neighbourhood team working is that in each of the two areas we have a core team. So Community Renewal in Edinburgh has a core team. Building Futures East in Newcastle has a core team. But this is a small core team. And the reason why we want to keep it as a small core team is because we want to see whether or not this test of change can be replicated. If it's successful, can it be scaled up? Can it be replicated in other parts of the UK? And so rather than having a larger team, which would require a lot of resource, what we're trying to do is see whether we can get donations of time coming from other agencies who donate their time into joining with our core team. So people come and join our integrated neighbourhood team from different agencies, and they donate their time into the Lifting Neighbourhoods Together initiative. And what we're asking agencies is to donate at least one day a week. But we hope as the project becomes more established, we may have donations of time which are closer to full time. And one of the things that we have said to the organisations that are donating time is that whatever the key performance indicators are which relate to that person's job, we'll help them achieve those key performance indicators, but just within a smaller geographical area. So they'll be achieving them within the area of the Lifting Neighbourhoods Together initiative. And each donor of time brings skills and experience into the team. And we have an idea of, an integrated team having skills including employability, benefits maximisation, engaging young people, engaging older people and supporting older people, skills around community development, place making, skills around education and training. And so we start off with our core team, and then we look to see which skills we have within the core team. And then we try to see if we can recruit people from the agencies who could provide the skills that we're missing. The idea behind the time donation is that they would spend 70% of their time working on their day job, and the other 30% of their time they'll spend working on engaging new people through systematic door-to-door engagement. And also they'll learn our holistic methodologies, such as our holistic assessment and case management process. And we've been delivering over the last year and a half, several rounds of training to organisations, staff who are interested in becoming time donors and joining the team. And one thing that we can say about the last year or so is that there's been a very, very positive response to learning this new, more holistic, more flexible way of working with people.
So I am donating my time as 1 day a week on behalf of the Health and Social Care Partnership. And I'm really excited at the prospect of working with Lifting Neighbourhoods Together because that project sounds like a very good way of working and holistic approach to people's difficulties around poverty, around lack of access to health services, around social isolation. And I feel that so far we've learned that communities affected by poverty are also often lacking cohesion and lacking confidence on in addressing these difficulties. And I believe that lifting neighbourhoods together have great recipe, have great ability to increase this cohesion and in this way address poverty and other difficulties that these communities are facing.
So the purpose of the time donors aligns with the systems change part of the project. If we felt if we could get frontline workers to adopt the approach and employ the methodology, then it's possible to create a replicable practice that's needed to bring about systems change. It was important really to think about where specifically we wanted to start this first year with time donors. This came about from considering which parts of the system and subsystems this project interacts most with. So from the front door engagement, the themes that were and are emerging were around social care and housing. The main two organisations that were mentioned time after time were Newcastle City Council and Your Homes Newcastle.
I think it was being very well supported through my organisation in terms of just allowing us to kind of, you know, be part of a project where we're getting to hear individuals kind of, you know, thoughts, feelings, views, what's happening in the community, what's important to them, what matters to them, and you know, from our perspective, you know, that allows us to kind of go back and have that time to think about, you know, what our services are providing, how might we provide them differently, what are we doing well, and what we can improve on. So in that sense, there's a lot of learning to be had for us as an organisation, for me personally, in terms of kind of getting back out there and meeting with people.
So through door knocking, we are picking up clients early instead of waiting for them to be referred into services at crisis point. Therefore, we're able to pick up issues and try and rectify them before they reach dire straits. And this it shows that we are present within the community, it puts a presence there for them. Whereas in other ways of working, you're waiting for the customers to be referred to you. We are picking them up, and it's very much prevention rather than cure.
It's fantastic actually to learn from them and see them bring their experience and expertise and connections into the work that we do. Both Daryl and Carla have linked the project into their organisations very well indeed. They've shared their intel and all of their information whenever we've needed it, and you know, hopefully we've reciprocated.
So we use a systematic way to engage everyone who lives in the neighbourhood, and we literally pick a street and go and knock on every single door. And what we do is we have a listening conversation that's trying to help them to reflect on what enhances quality of life in that neighbourhood and what takes away from quality of life in the neighbourhood. What would improve their individual quality of life, what would improve their community quality of life.
A lot more green space for the kids to play in, and maybe some outdoor drying facilities. Instead of having to use energy in the house, I could cut down my energy usage.
Maybe some nice play park for kids, like, you know, teenagers or like maybe his age, because it's like nice playground, but it's like for like little children, but for them it's quite not very much fun here around. But
some of the really positive things that are coming through, lots and lots of people really like their communities, really like their neighbours. They say it's very much a community. People look out for each other, people help each other. You know, they don't feel isolated, and again through COVID they didn't feel isolated because they had their neighbours checking up on them. Neighbours were doing shopping for elderly or people who were vulnerable, which was really, really nice to hear. You know, they've said it's a very close community. People are very, very friendly. People watch out for each other. Kids play with each other in the neighbourhood. So that's all been really, really positive.
And what we're looking for is people who've got ideas, people who want to make things happen. And very quickly, we start to see small groups of people coming together around particular ideas. For example, in Edinburgh at the moment, we have some people who are really keen to get the community centre reopened because it closed at the start of COVID. And that's had a big impact on that neighbourhood, because it's the only place really where people can meet. And that's had a big impact on people's ability to socialise and come together.
Yeah, well, they're actually in the moment helping us to get the centre back open. So as soon as we can get the centre back open, then we can actually get the wheels running on basically everything else. I'm the youngest of 5, and we had the centre that was up there. This was on the Friday. It was somewhere for it to go, and it wasn't as much trouble. And I'm wanting the centre open so I can help the kids out in Bingham, and more for the pensioners to start maybe even get the 50 club or something back open.
So my role at Community Renewal is health case manager, and so I support people who are in I suppose need of mental health support or physical health support. I've been able to go out with one of my colleagues, and we've been able to tap on doors and speak to people, and they've been really, really helpful in speaking about what they would like to see in their local area, and also what's also going, you know, reasonably well as well. When it comes to that, you know, one thing that during lockdown and through the changes, I have in partnership, I suppose, in partnership with Castle Rock Edinburgh Housing Association, we've set up a local pantry. So it's the Hayes Community Pantry, and that's to help with food sustainability and food dignity as well. So we've got like a really open system of people can pay, you know, for however much food that they wish. Any food that they would get at the pantry would be, any fresh food would be free, and then they would pay for possibly other items as well. And yeah, so we work together with Fair Share and Edinburgh Food Project and Morrison's. So Marks and Spencer's, they also give food as well every week to us, and that's been going since May, I think it was.
I got involved in the pantry due to lockdown and just being in the house all the time, and I thought, you know, I could do something here for the community. I feel I'm giving back something to the community. It's nice to meet people in the community. Although I've lived here 20 years, I've really kept myself to myself, and it's just now getting to know people. Even when I'm popping around to the wee shop, I can see faces that I know.
I have bought general goods for food, which have been reasonably priced. In fact, very, very good prices. Cheaper than your Aldi's and your Lidl's and Asda. Got free stuff as well, potatoes, vegetables. I've got breakfasts, I've got dinners, I've got teas. A great idea, absolutely great idea. I wish I'd known sooner about it. It's really handy, and it's only along the road. It's only a 2-minute bus journey. Yeah.
But as we begin to listen to people, we distill their answers to what would improve the area and what is taking away from quality of life in the area. And we work with the people in the neighbourhood, we work with the community to create a shared vision of what they think improvement would look like at a community level. And that vision usually has a set of themes, and we invite people to come together who are interested in a particular theme. So it could be, for example, the physical environment. In Edinburgh just now, we're working with a lot of people who really care passionately about the environment of Bingham and Magdalen and the Hayes, and have lots of ideas as to how to improve that. And we're bringing them together to try and create a bigger impact than they could have as individuals. So over time, we'll work with these small groups to turn their broad aspirations into project ideas and support them to apply for small pots of funding to get their ideas up and running. And we support them to manage their projects. And so an important part of the Lifting Neighbourhoods Together initiative is about developing a social capital and supporting people to get involved in actually making their place a better place to live. Because one of the things that we realised in community renewal was, even although we could be very successful in lifting large chunks of a neighbourhood out of poverty, if the neighbourhood didn't improve, if there wasn't a sense of community, then quite often people would move to the next best place.
It's great that people can bounce ideas about, and then we can try and find out what's really maybe top of the list or whatever, or somebody might bring something totally out of the box to it that we've never thought of. So I think it's important for that point of view. And you can actually find out what people in Bingham actually want.
So one of the expressions that we use a lot in Lifting Neighbourhoods Together is system change. What do we really mean by system change? Well, at the moment, as we talked about before, organisations tend to be set up in quite narrow silos. And what we have realised is there's a strong desire among our strategic partners to do things differently. You know, so there are policy initiatives coming out like 20-minute neighbourhoods, which are about trying to make sure that everything that someone needs is within a 20-minute distance of walking from their home. And we've had lots of conversations over the last year or so with our strategic partners about their aspirations around system change.
This comes from 2 years of work of the Edinburgh Poverty Commission, which was set up by the council to be an independent group of people. The commission, the council and Edinburgh Partnership asked to go away, do proper inquiry into the causes and the solutions of poverty in Edinburgh, understand the reality of poverty in Edinburgh, and come back with a plan to say how the city should respond. And what they did was, at the end of 2 years of work of listening to citizens, of talking to experts by experience, people who are active in anti-poverty work in the city, published a plan in September last year, which set the city a 10-year challenge to eradicate poverty from Edinburgh, essentially. They set a target to say Edinburgh should aim to end poverty by 2030, and they put very, very specific goals on what that meant. So they said, that doesn't mean no one ever falls into low income, but the number of people who experience low income should be much, much smaller and in line with the best performing areas in Europe. And most importantly, it means that people should experience poverty as a temporary experience, not a trap that affects them for long periods of their life. The final part of that definition, which I think is a really important shift for the way the city thinks about poverty, is to say that ending poverty isn't just about getting money into people's pockets, although that's a huge part of it. It's also about ending the stigma that's associated with seeking help, and bringing some compassion and some humanity to the experience that people have when they seek help to escape from poverty in Edinburgh. So that was the Poverty Commission's challenge, and that was the report they published last year. Since then, we have been working with the council, with partners across the city to shape a response, and we've just published our first annual report on that. That shows the progress we made in year one and the priorities that we're going to focus on for year two going forward. All of that is about responding to the now, getting money into people's pockets now, responding to people's crisis needs now, but also building the foundations for that longer system change that we need to have that more compassionate, more people-centered, more humanity in the way the system works. That really important aspect about the relational aspects of poverty, what it feels like to be in poverty and to seek help to come out of it. And what we heard throughout the Commission's work was that People were being passed from pillar to post trying to seek help. They were having to retell their stories over and over again. They were not being treated with dignity and respect everywhere. The system of support seemed disjointed and illogical and absurd in a lot of ways, barriers in place that shouldn't be there. We might be very good at solving one problem, but we were not very good at, the system in general was not very good at helping people in the round. Of what the Commission then asked for was to say that we make a really radical shift in the way that we think about poverty supports in the city. We should be saying there are no signposting, no referrals, no handoffs, no wrong door for supports. People should be able to speak to a trusted intermediary, which might be statutory sector, it might be third sector, doesn't matter, it's the right person for them. And from that first contact, be able to find the support that they need in a way that doesn't just focus on one problem, but thinks about the entire household, what the entire household, the entire family needs. So an example would be, rather than going to your homelessness service if you have a homelessness problem and then having to find support around benefits and then having to find support around employability, you could go to one contact and get all that support in one place. And you would have teams that were skilled and recruited and supported to be able to do that, no matter where you were in the city. So what we've got as part of the Commission's work and the Council's response to that is a really serious look at the way the statutory sector does that. And in essence, what the Commission said when they were hearing about lifting neighbourhoods together in the work of community renewal was that actually this is work that's already in place that is living and talking the very values that we want to see across the city. So in the way that the Council takes forward its plans, I think we see the work that community renewal are doing as a really important one example of how that can work. We're really, really keen to see how the project develops. We want to work with the project and take the learning from that into how we can change systems across the city as a whole. And to see it really as a collaboration on a number of different initiatives who are all looking at the same problem from very slightly different angles. And from thinking about a package of innovations across Edinburgh, I think we can hopefully get some really positive change at the back of that. We'll get to what that Poverty Commission ask was all about in the first place. Yeah, so where we are at the moment is we are doing a lot of work internally to develop the teams and the structures that we need to make that system change and that idea of long-term change. And we are in the process of talking to community renewal and other partners in the city to build a governance structure that lets us join these together in a way that's going to work, that's going to make sure we are sharing that knowledge and we are seeing it as one mission rather than a lot of separate pieces of work that are going on. And that's where we're at the moment. We're in that process of trying to make that governance structure make sense for everybody and take things on, weave it all together in a nice pattern.
In the Lifting Neighbourhoods Together initiative, we have appointed some learning partners. One of those learning partners is an organisation called Sonnet, and Sonnet are supporting us at the moment to try and understand the system a bit better and try to be able to see where is it at the moment and see if we can track progress in the system over time.
Sonnet is the learning partner for Lifting Neighbourhoods Together. Essentially, it means we work alongside the team to help them monitor and adapt to any changing needs. We also help the team to draw out the learning of what's working well and where an alternative approach might be needed to improve the overall effectiveness of the team's work.
Stakeholder mapping is a powerful exercise that we have used with the team. By involving the whole team in mapping the key relationship they have in the community, we can spot strengths and gaps in the network and identify the key potential partners who need to be drawn in to improve outcomes and resilience in the community.
And so one of the things that we've been doing recently is to try and make the system a bit more manageable to understand. We've broken it down into 8 chunks, and you know, you could call those subsystems. And some of the subsystems that we have are young people, children and families, work and pay, housing, education and training, mental health, physical health and well-being, benefits, bills and money, relationships and isolation. And what we're trying to do is at the moment we're mapping out those subsystems to see, well, what are the agencies that are currently working in those subsystems, and to what extent is the network between those agencies working well in a joined up way. One of the things that Sonnet and our evaluation partner Sheffield Hallam are helping us with is to look at the maturity of the system and the maturity of some of the subsystems. And what we've found is that if we look at the whole system, it's difficult to say, using the 5 stages of maturity that Sonnet have introduced us to, it's difficult to do that for the whole system. But when we begin to look at it in terms of subsystems, it's a little bit easier. And what we're finding is that some of the subsystems are way more developed in terms of the relationships between organisations and the partnership working. As the system develops and becomes more adapted to the needs of the population rather than the current situation where we have a plethora of services that have sprung up, each with their own set of rules and regulations. One of the things that we know is going to be needed is a shared way of working between organisations. And this is one of the key elements of training that we've been providing to our time donors and to other partners. And one of the key elements of the training is something that we call a holistic assessment. And a holistic assessment is when we look at the future with a person, we try to get an impression of what would life be like for them a couple of years down the road if there had been a lot of improvement in their life. And we build up a picture gradually with them of what their current situation's like, what's their typical week, their social opportunities, their family situation. We then look at their health, we look at their self-care, we look at their housing situation, we look at their financial situation and their employment situation. And we work up to this vision of the future of what change would look like. And once we've established, you know, that vision, then what we're able to do is we're able to share that person's vision and that person's goals with each of the different organisations that come in to support them. So the person doesn't have to tell their story all over again. We're able to share with their consent the key information so that the support that they get from those other agencies really becomes quite seamless.
Yeah, so we were initially involved in the original training delivered by Paul McColgan, who, and the training that we did was the listening conversation and the holistic assessment, which is what we carry out now during our door knocks. Your clients are at the centre of the assessment. There's no targets, there's no strategies that you have to follow, there's no ticky boxes. It's literally having the client take the lead on their programme and their development.
But what was really interesting was that you're kind of being led by the person in the sense of where that conversation's ultimately going to end up, and then picking out some of the nuances across, you know, from the discussions you're having. And certainly there's a real opportunity to afford some time with those discussions across across that whole holistic assessment, if you will.
So my name's Joel Sinyard Jones, and I'm the Senior Link Officer as part of the Neighbourhood Transformation team. On top of kind of what we all do as a team in terms of sort of engaging with people on a day-to-day basis and essentially working towards whatever goals it is that they kind of identify to us that they would like to work towards, you know, whether they will be for themselves or their families or their communities or a combination of the three. Essentially my role is to sort of identify and cultivate the sort of networks and the organisations who maximise someone's chance at success at achieving those goals that they've set for themselves. So in terms of what the networks might be and who the organisations might be who you know, we're kind of building partnerships with, that'll depend very much on whatever pathway somebody wants to sort of pursue. So for example, if someone's identified employability as a particular goal, then what we would be doing is identifying, you know, working with the job centre around kind of what their commitments might be, working with kind of wellbeing organisations around kind of mental health and confidence, education providers for qualifications and skills, and then with employers around kind of maybe mock interviews and guaranteed interviews and things. And then other third sector organisations as well for things like, you know, interview clothing or various things such as that, so that people can approach whatever goals it is that they've got with kind of maximum confidence and every chance of success.
The best days are when the whole team are in and are gearing up to go door knocking. There's a real buzz in the space. They come back from door knocking, they're full of energy and humour. They discuss various ways of working with the people, and they share opinions about what they've just heard or learned while working in the community. And then they exchange expertise around how to support the people on the issues that they have just heard, and also share a lot of the positives as well. There's a very strong community in Walker and in the east of Newcastle generally, and some of the feedback often covers the strong community element that's prevalent in the east.
I think one of the things that we noticed as a team throughout lockdown is that the task of kind of engaging with people on their terms, kind of totally approaching them without an agenda and without any sort of preconceptions. I think people were just really grateful to have the opportunity to just talk about what it was that mattered to them, whether it was on a large scale or a small scale. And just kind of speak freely about the sort of changes that they might like to see for themselves or people they cared about. And it was clearly something quite unusual that they hadn't been expecting to hear, and they engaged with us kind of really quite openly from the start.
Manager, I'm here today with Kay, one of my ladies who I've been supporting. So Kay, can you tell us a little bit about what sorts of work we've been doing together, and what you've been getting up to and what difference it's made to you?
Hi. We've been doing so much together. You've helped me with English and getting out to do cooking and different courses and that, and it's given me such a boost in confidence, because at one time I wouldn't leave my flat, and thanks to the support from you and others for Building Futures East, I'm getting out and about a lot more. I'm actually starting to enjoy life for a change instead of being stuck in the flat 24/7. And I'm so grateful for all the support from you and others that I'm working with.
Thanks, Kay.
So another lady I work with was very immature in her approach through no engagement with society for many years. Through careful engagement on taking the person seriously, work could then be carried out with the person directly, involving other branch of the charity, as well as the income could be driven up through gathering proper evidence, so to make a personal independence payment application, which was successful, as well as proper medical evidence to support a disability allowance. This now put her in a financial situation which allow her to, for example, take the bus regularly, have more secure electricity, which in turn allow her to attend and engage with different groups, which then hopefully will help her to move on in her life.
So Jane, do you want to just tell us what you've been doing with Building Futures East over the last few weeks?
Computers and everything else, and it's good. It's a laugh when you get laugh with the staff. Friendly.
What sort of things have you been learning then over the last few weeks?
Computers, doing on houses and everything else, so just gotta wait now. All you've been polite and you've been talking to her politely.
A key aspiration of lifting neighbourhoods together is that we use data in a more intelligent way. And if we think about poverty and if we think about lifting neighbourhoods out of poverty, there's key data at the moment that's held by different parts of the system. So, for example, the Department of Work and Pensions hold data on everyone who's currently in receipt of universal credit. HMRC currently holds data on everyone who's in receipt of working tax credit. The council holds data on everyone who is in receipt of free school meals or in receipt of home care allowance, etc. But one of the things that we found at this stage in the project is it's very, very difficult for us as the Lifting Neighbourhoods Together initiative to access that data. There are lots of rules and regulations around GDPR. And one of the things that we've started is to begin the conversation with some of these strategic partners to say, what would it take for us to develop a data sharing agreement between us? If we manage to achieve a data sharing agreement, then we're going to be able to really accelerate some of the work of the Lifting Neighbourhoods Together initiative. So, for example, one of the data sharing agreements that is in process at the moment is between the Lifting Neighbourhoods Together initiative and Skills Development Scotland. Skills Development Scotland is the national agency responsible for training and post-school training, but they also have to keep data on every child that leaves school and whether they achieve a positive destination or whether they are able to sustain a positive destination. And one of the things that we're in discussions with Skills Development Scotland about at the moment is to see, could we get access to the data of every child who left school in the LNT area in Edinburgh? And if we can, then we can go and visit them at home and find out, did you manage to get a positive destination and how's that going? You know, if you started college, is it going well for you? Or did you drop out of college? And we're interested in going back 2 or 3 years to be able to contact all those young people who left school. Because one of the aspirations of Lifting Neighbourhoods Together is that every young person in the neighbourhood goes on to education, training or employment. Another data set that we're interested in relates to a benefit called the Scottish Child Payment. And the Scottish Child Payment is an additional £20 that can be paid to a child between the ages of 0 and 6. And so we're in discussions with the council and the NHS to see whether we can access the data to find out where all the children between 0 to 6 live within the neighbourhoods that we're working, so we can contact them at home and find out whether they've been, if they know about the Scottish Child Payment, if they've already received it, if they're eligible for it, and if they need any support to access it. Another one of our learning partners is called the Tavistock Institute. And what the Tavistock Institute are helping us with is looking at the dynamics between organisations as we try to move towards a greater degree of coherence in the system. What sort of things get in the way and what sort of things are helpful to us as we try to make the system more coherent and more services more orientated around people's needs rather than people trying to fit in with the services. Another thing that the Tavistock are helping us with is understanding the journey of the time donors, moving from their existing role into the new role that we've created as part of the Neighbourhood Transformation Team, and to learn from that experience of our time donors and what's different, what's made it more difficult, what's made it more easy, and also how does it feel to move from quite a narrow silo, a culture where maybe there are more rules and regulations, to moving to a culture where there are fewer rules and regulations there's a much greater degree of flexibility, and there's a much greater ability to work in a holistic way. And the Tavistock are our learning partner, really walking alongside us during the project to help us understand that.
The Tavistock Institute is a public organisation. It's got charitable status, and its function is to conduct research and offer consultancy from the social sciences. We look at social issues, like lifting neighbourhoods together in poverty, and we offer advice, guidance, consultancy on how to do things better. The idea came from Paul that the teams that we're going to be working with the neighbourhoods will require support, insight, understanding into the dynamics of complex systems. And that is our specialty. We are aware of just how difficult partnerships are usually, what gets in the way of partnerships working effectively together. And we work with the teams as well as the managers and the directors and the stakeholders to understand the complexities of what they're trying to do, so that they can do it better and achieve their goals in the way that they would like. From our experience, we know that partnerships are always difficult, and when times are difficult, partnerships usually run back to their own corners. So we will be looking at that and trying to help the larger system stick together more strongly. The chances of lifting whole neighbourhoods together out of poverty increase when the big stakeholders work together well.
COVID has had a massive impact on the project over the last 12 months and actually the last 18 months. Just before COVID, we were in a situation where we had a large number of time donors ready to come and join the neighbourhood teams. And unfortunately, after COVID struck, the organisations that were ready to release people to become time donors had to divert them to more urgent activities related to COVID. Another impact of COVID has been the breakdown of community connections. So many people have been stuck in their home for 18 months. And also we've seen some of the facilities where people would normally have been able to come and gather and go and play bingo, or go and have lunch with other people. These facilities have been closed for the last 18 months, and that's had a big impact on the community, and it's also had a big impact on our work. There's an increase in fear and anxiety, I think, in people, and we need to be cognizant of that our starting point for lifting neighbourhoods together is very different from what it was pre-COVID. And that's one of the reasons why we wanted to organise a fun day. We wanted to create an opportunity for people to come back out, meet each other, socialise, have a bit of fun together, particularly families with young children, to get the chance to get them out of the house and let off some steam and burn off some of their energy. And what we really found that the fun day was a great experience, and a lot of people told us how much they enjoyed it and how much they would like to have more events like that in the coming months. So what about the next 12 months of the project? We're now in conversations again with the organisations who are able to donate time, and we're going through at the moment setting up the governance structures so that can become possible. We also we've been doing several rounds of training and induction, training new time donors in our holistic assessment and our listening conversations. We're quite close to being able to establish the community fund, the onward granting scheme in each area, which will allow the community to bid in to access small pots of money to run small projects. And we're excited about that because we have the community forum in place to be able to assess whether or not they think that the ideas for funding meet their vision and meet their criteria. We've started to map out the systems, and over the next 12 months, we'll be doing more relationship building within the subsystems. And we hope to, in the springtime, bring the subsystems together into a conference where we introduce the whole system to each other, both in Edinburgh and in Newcastle. So we hope that the next 12 months we're able to accelerate the project, and hopefully most of the restrictions that we've faced in the last 12 months will no longer be in place.
I feel the Lifting Neighbourhoods Together is such a great project because you don't turn people down. That's what you know, what we've been talking about, the silos, working in silos. Yes, you are, you know, because you fulfill this and that criteria, you tick all these boxes. So yes, we can take you on, so you can easily demonstrate our outcomes, which in actual fact, life is not, you know, that clear cut, and things change and people have different circumstances at different stages of their lives. So, but yeah.
The coming month, I'm looking forward to continuing to build relationships with the team, with the other time donors. It is invaluable sharing information, understanding and gaining knowledge of services that I don't generally come into contact with on a day-to-day basis within my usual role.
Okay. I guess over the coming months, particularly now that we've got a sense of where we are in terms of, you know, our COVID kind of working practices, we can kind of develop that. We're really interested in getting that kind of learning for the project, and I can then take that back, discuss that with my immediate colleagues, and see, you know, and just get a sense of where we're at. You know, is our understanding the same as what we're getting from those themes and those issues that are being raised throughout the project? So absolutely, it's super to be part of it.
My name's Kay, and this is what I wrote last week. I get on well with people. I walk in and everybody says hi. So many I struggle to remember names. My family went their separate ways, but when I first came here, I was scared, backing off all the time. Sitting like a wallflower, trying to blend in with the walls. But I have confidence now to mix with people and engage. At my groups, I was told I was a part of the team. If I can't make it somewhere, I've been told they'll come for me. It feels nice to belong. Usually I'm self-conscious, but now I'm a part of the community, I feel comfortable. Writing this, I have tears in my eyes because I'd never felt like this before. With my group, if I get confused, I just ask, and somebody will go over it until I get it. They are so patient. I want to be there and they want me there too. It gives me a reason to get up in the morning, get ready and leave the flat. It means such a lot. I've always struggled and little things mean such a big amount.